has been generated. So this is the PDF that was generated. It goes through basically a report of findings on posture, their displacements, how abnormal structure changes. It will affect the physiology of the body. And here is her report of findings of her postural displacements. And what's nice about the software is it uses estimations on, for instance, let's go ahead and use her forward head posture. I'm going to blow this up so you can see this on the video. And this is based on sound scientific principles and literature. It says that her head is 24 millimeters forward. Her actual weight of her head is 9.2 pounds. It's an inch forward, so the effective increase in weight is 8.8 pounds per inch, and the total effective weight increase is 18 pounds. That's what her head actually feels like based on physics when her head actually weighs 9.2 pounds. That's pretty powerful for the patient to understand. And there's lateral views. So the red line is where the patient is. The black line is normal. They can see that they're not normal. And if we scroll up here, let me make this window a little bit smaller here so you can see more of the PDF document. We have the displacements in degrees as well as the z-axis. So obviously her head is 24 millimeters forward, the thorax is 9.2 millimeters backwards, and her pelvis is 71.8 millimeters forward. So those are the displacements from normal. Moving on to the AP view, I will blow this up for you so you can see. And let's go ahead and do the same thing. It said calculate lateral shift head, the lateral shift of the head posture. Again, adding this to her displacements from the forward view, you can see that it's no wonder why she would have some upper back and neck pain. And again, the unique thing about PosturePrint is it's the only software that can calculate R, Z, and the rotation Z, rotation Y, and rotation X, as well as the translational distances. So 3 dimensions of analysis. It's not just a screening tool, this is a clinical tool. So what you can see here is that her head is laterally flexed to the right by 3.3 degrees. Rib cage is laterally flexed to the left by 2.9 degrees, and you can actually see that. See how her rib cage is laterally flexed. And anything less than 2.5 degrees or 2.5 millimeters is going to be classified as within normal limits. Now the translation on the x-axis, this is unique to PosturePrint. No other software is actually translating and discriminating between rotations and translations. A lot of software companies out there like to tout their features, but none of them can actually do this for the average clinician. So this is what differs this as a clinical tool from a screening piece of software. We're able to differentiate the rotations and translations of the patient. So in this world of evidence-based medicine, this is something that you need to document, because when you're treating the patient, our goal of care is to improve the spinal structure. So you can see her head is translated to the right by 15.2 millimeters, and her rib cage is translated to the left by 4.3 millimeters. And you can see that visually in her posture. Now, the posture index, which we go into in our seminars, how we derive this, and this is being written up again for another study. We're putting a numerical value on the displacements within the patient's max range of motion based on the literature, and assigning the number so they can understand exactly what their patient index is. So her patient index, or posture index, rates a 21, which is moderately displaced. Okay, there's her pain scales. Her exercises, it goes through what differentiates these exercises from the average physical therapy exercises that are based on function, not structure. It goes through the treatment protocols. So this is a chart that will actually go home with the patient, a log, so they will be accountable. They'll bring in their log once a week and review it with the doctor. Plus they're doing the exercises in office as well. The exercise descriptions are right here, so it tells you exactly how to do postural displacement exercises, known as mirror image exercises, which is chiropractic biophysics. Mirror image exercises. These have been shown to be very effective in returning the patient's structural displacements towards normal. And of course, we go through this in our seminar series. For more information on CBP seminars, please visit www.idealspine.com. Now, back to the summary view. What I like about this is in my day-to-day treatments, I use a computer-based system for management of records. But with this PDF, if you use a travel card that is just paper, you can go ahead and staple this to your travel card so you can see exactly what the patient's displacements are, their posture index, and the exercises that you prescribe to the patient. How many times, doctors, do you forget what patient exercises you prescribed? And you have to dig through your records to find out when the patient asks you to demonstrate those exercises. What's nice is that those exercises are written down right here. Now, in my practice software that I use for my office, I can actually put this PDF or JPEG image right there, so I can pull it up in real time. In about 1 to 2 seconds, I can have this open up for me when the patient is at that visit. Okay? So if you have any more questions about the benefits of using PosturePrint software, please visit www.postureprint.com.